I'm just delighted now to turn to my friend and colleague, Annette Fellows. Annette is the chairwoman of our sister organization, the Foundation for Social Connection, which is a 501c3 that was founded by my dear friend and colleague, Eddie Garcia, who's in the room here somewhere. Eddie. Annette, please come up and offer us some thoughts on the 501c3. Thank you so much.
Back to follow, but literally my first two comments to you are going to be, if you remember nothing about my comments, remember these two things. And of course now I can't remember it. The positive impact from social connection on each of us personally, and she couldn't have said that better, right? And secondly, we all have the opportunity to share that impact and encourage it through others. So remember those two things. So as Andrew said, Annette Fellows, CEO of Return on Vision Consulting. I work with leaders to help them translate their visions into measurable value, keyword action. A couple of which are actually healthcare leaders who are working in the Medicaid and Medicare space to help reduce social isolation and loneliness. So win-win on that, right? And then of course the board chair role, I took in that on late last year. And Eddie, I have to tell you, big shoes to fill. I am very honored to be building on kind of the vision that he has started. And thankfully, he's still on the board with us, so that's all good news as well. So my passion for social connection really stems out of three pivotal experiences in my life, right? Again, thinking about each of us personally. The first is losing my father very suddenly at the age of 30. I was 30, not him. And the overwhelming sense of community that surrounded me and my family during that time, from the social connections that he had built over his life on things like bowling. We've all read the book, right? Bowling and golf and, you know, just being part of the community. And so that experience made me very intentional about fostering and nurturing my own social connections, my own community ever since. The second was caring for my mother, who lived with ALS for 13 years. She had the most remarkable resilience that was fueled by her strong sense of purpose, her optimism, and her social connections, her community that stayed around her during that time. And she really taught me the transformative power of those, what I call protective factors. The last experience actually is I worked at United Healthcare for many years. And during that time, I had the privilege to manage the relationship with AARP and lead the clinical innovation team that was part of that relationship. The work that that team was doing was on personal determinants of health, not to be confused with social determinants of health or healthcare determinants, which really focus on the risks and are expensive to treat, but on the internal strengths or protective factors that we can all leverage. And guess what? The work that they were doing, the research that they were doing, was finding that resilience, purpose, optimism, and social connection were important to overall well-being. And that by exploring and working with these factors, we could actually improve member experience, engagement, health outcomes, and reduce costs. And so the more factors that you had, the more that we leveraged and focused on those, the better our outcomes. So those three experiences in my life really have made social connections so important to me, have shaped my perspective and my commitment to the topic. So with that, I'm pretty excited to be here today to be talking to you as the role board chair for the Foundation for Social Connection, because it's a natural extension. Our vision of the foundation is that we have a vibrant society with social connection at the center of how we live. How perfect could that be? And our mission is to advance social connection nationwide, rooted in evidence for our collective well-being. So with that said, last year we worked on our 3-year strategic plan that has 3 key priorities. The first is around research and practice. And so building out the evidence, which of course we've all heard much of the evidence and there continues to be more added. So building out that evidence, disseminating it, and then translating into the action, my favorite phrase. And so we do that through our advocacy consulting and by partnering with the Action Network to inform their policy recommendations. And so we have kind of 3 examples of work in that area. We have our Older Adults Act, the Advocacy Project, We have our active action guide for committed communities, which we are doing, our connected communities doing with the in partnership with Health Places by Design. 10 communities already active, and we're gearing up to launch our fourth for our next cohort now. And then the last piece is the social framework, which Andrew already talked about. We have continued to release reports on where you can connect to the social framework, whether it's in health, education, built environment, and the latest one actually is food and nutrition. So that's the first pillar. The second pillar is around network and partnership, and how do we help convene across the ecosystem to advance social connection. And we do that through a couple of ways. One is we've got some cross-sector work groups and community of practice around older adults, young adults, intergenerational, as well as corporate councils. And secondly, we have our conference coming up. Jillian Rakusin, our executive director, who is here somewhere, wanted me to remind you all that you can sign up today, get your tickets. We have the early bird discount until June 15th. And then the final pillar is all around storytelling and communication. And how do we shift the narrative around social connection to make sure that people realize it's essential to our collective well-being. And one of the items that we just launched there is our ambassador program. So we would love to have you join us to help us advance our vision and mission, to help us turn our priorities into action. Talk with Jillian, talk with me. Please visit our website because you'll see all of the tools that out there. So looking forward to connecting with you all. And with that, Andrew, thank you.